Good afternoon, everyone. I'm Tom Stolz, Sedgwick County Manager, here today to talk about the COVID-19 update for August 26th. That's our weekly update session. And we'll go through the routine of the numbers first, starting in national. In the country, in the last 2 days, we've gone up 1.34%. So the case total, COVID positive case total today is 5,791,222. The state of Kansas in the last 2 days has gone up 4%. So we stand in the state of Kansas just a little short of 40,000 cases, 39,937. The death rate in Kansas is at 437 people. In Sedgwick County, our case totals went up 3.87% since Monday. We went from 6,351 cases to 6,597 cases. That's 246 additional cases, and about 120 of those are from our ongoing jail cluster. So depending on how you look at that, it may not be as bad as it seems, but the jail cluster is a significant problem. Our Sedgwick County deaths has gone up. We are at 50 today. The peripheral counties, Harvey County reporting 286 COVID cases, Butler with 404, Cowley 247, Sumner 117, Kingman with 39, and Reno with 699 cases. So all of the peripheral counties are also seeing an increase in cases. Compared to a week ago when we met in Sedgwick County, our cases went from 5,489 on August the 19th to 6,597 cases today. That's a 20.19% increase, 1,108 cases in a week. About 750 of those will be from the jail cluster. So a significant portion of that is because of the jail situation. And we've had a lot of discussion moving forward how we're going to show the jail cluster in relation to the dashboard, in relation to the community. And it's interesting because the jail is different than other types of clusters, such as long-term care facilities or prison environments, which have, when you compare to a jail environment, a relatively static population. The jail, as the sheriff talked about yesterday a couple of times, the jail is the gatekeeper for the justice system. There is a constant coming and going of people. It is a very fluid and dynamic environment over there. It is not a group that's going to be there for 2 and 3 months. Some will, most will not. So it's transitory in nature. So we look at those cases coming out of there as community types of cases. Because a lot of the people that tested positive over there are back on the street now. And you have to remember, when we talk about the jail cluster, the sheriff started that project at the very beginning of August. So this is over the course of several weeks. Many of these people are past the 14-day period of having the virus, so they are past infectious level. So it's a very interesting dynamic, these cases. Concerning and problematic for the sheriff, but we have to take that with a grain of how we look at the community numbers right now. From a testing perspective, we've had 73,000 Sedgwick County residents have been tested year to date for COVID. We had 88 residents scheduled today at our drive-through facility. Still continuing to do testing at the facility on Edgemore. Call the 211 system to get in if you have any kind of symptom of COVID. When you go get a test these days now, you are given a portal access to where you do not have to wait for a callback on your results. We're trying to move that as fast as we can. We had some information this week, though, that the Cahill lab, the state-run lab, was running up to 4 and 5 days behind, so there's still a delay in getting test results back. The mobile outreach team will provide no-cost COVID testing for symptomatic residents or contacts of COVID positive people, or the people in certain high-risk professions. Their outreach team will be at the Bridge Church, which is at 2328 East 13th Street in Wichita, from 8:30 a.m. to 11:30 a.m. on Monday, August 31st. The current public health order is still in effect until midnight Tuesday, September 8th. Dr. Menz will amend that order or reestablish that order sometime between now and then. The small business grant application is now live on the county website, www.sedgwickcounty.org. Small businesses with up to 50 employees may be eligible for a maximum of a $5,000 grant for their businesses. The deadline for the application of this is September 11. Public health care and social service providers may apply for CARES funding on our website as well. Examples of eligible COVID-19 related expenses include establishing and operating public telemedicine capabilities for COVID-19 related treatment, acquisition and distribution of medical and protective supplies, and expenses for disinfection of public areas and other facilities. The county has ordered significant PPEs for businesses in the community, which will be arriving within a week or two. Distribution point for that will be at the arena, and more information will be coming out on that in the next few days. That is all I have for today's update. We will be back in a week to update the newest numbers. We have a special meeting tomorrow. The Board of County Commissioners will be talking to the Citizen Oversight Group that helps us with CARES management. That will be at 10 a.m. tomorrow, and that will be available through streaming and Facebook social media. So thank you. We'll see you all next week.